Gibbs Modified Bed Bath, face and one arm, hand and underarm. This skill is used between shower and bath days for patients who are unable to get out of bed. It promotes good hygiene, patient dignity, and decreases infection. If performed incorrectly or infrequently, it can lead to offensive body odor, infections, and skin breakdown. You will have 6 to 7 minutes to complete this skill. You will need a clean gown, a large basin, 3 washcloths, a large towel, soap, a privacy blanket, and gloves.
Hello there, Mrs. Johnson. It's Nicole. I'm back again. Just wanted to give you a nice little sponge bath, a modified bed bath today, and put you in a nice clean gown. Is that okay? Alrighty, sounds good. I'm going to go ahead and put your bed up to waist level. As you notice in all skills that require any leaning over the bed, you want to make sure you protect your back. I'm going to put the head of the bed up just a little bit, no more than 30 degrees, just so I can engage with my patient a little bit while we do her bath. Okay, so I'm going to just raise the head of your bed up a little bit. Not too high. If you put it up too high, everything falls down. So just a little bit. Okay. So now I'm just going to go ahead and walk around and give you some privacy. Okay, Mrs. Johnson, I'm going to go ahead and get my supplies and I'll be right back. So wash hands. Always wash your hands before you touch your supplies, and remember that's simulated for state. Okay, so again we do a pre-prep, and the pre-prep is the sheet to the waist. And then we immediately put the blanket over top. So again, you can do exposure as long as it's a quick exposure, no prolonged exposure. So immediately go ahead and cover your patient up, no shaking. Lots of germs and bacteria. We don't want to shake that around, so we want to place everything gently. Okay, so now we're going to go ahead and undress your patient. You want to undress your patient before you get the water. And there is no affected side on this skill, so the patient can actually help you. So go ahead and dress them, keeping them covered and warm the whole time, in addition to maintaining dignity. So I just take the gown and scoot it over, so when I walk around to the other side, it'll already be halfway there. Okay. Then we have this side. Go ahead and help her. So you can go ahead and help me pull your arm out, please. Thank you. Let me go ahead and get the gown out. Remember, gently pull the gown out. We don't want to tear skin. And once you get the gown out enough, go ahead and roll it into a ball. You don't want it to touch you or the patient. Go ahead and bring this back around. Put it into the dirty clothes. Okay, Mrs. Johnson, I'm just going to go ahead and go to the sink and get the water so we can start the bath. The supplies that you will need here, you need 3 washcloths, a large towel, a clean gown, your soap, and your gloves. I'm going to go to the sink and get some water. Okay, we go ahead and turn the water on. We simulate washing hands for the purposes of state. You want to test the water, make sure it's not too hot, not too cold, no more than 105 degrees for the patients, so we don't burn them. Let me go ahead and fill the water up, fill the bucket up. You don't have to put a whole lot, maybe about halfway. For testing purposes, we can go a little bit less than that. We want to make sure we have enough water to wash as well as rinse. Okay, once we have enough water, go ahead and pull the bucket out. You want to grab a paper towel. You want to turn the water off. The faucet is considered contaminated, so go ahead and just turn that off. Throw that away, and then we go ahead and walk back over to the bedside, and don't forget your soap. Okay, Mrs. Johnson. Okay, so let the patient, so I've tested the water is good to me. So now we're going to let Mrs. Johnson test the water. Be careful with the water. Mrs. Johnson said the water feels great. So now that the patient has also okayed the water, now we can go ahead and put our gloves on. want to wash the face first. Just go ahead and place the towel on the chest. Remember, don't shake, just place it on there. You just want to have it folded in half once. The open flaps towards the feet. Okay. So now we want to wash the face first. There's no soap on the face. We don't want to irritate the skin, so no soap. We want to fold the washcloth into fours. I'm going to get it wet. Take it all out. And we start with the eyes. I'm going to just turn the mannequin's head a little bit there. So we go inner corner to the outer, and then we flip. Inner corner to the outer, and we flip again. Always use a clean surface. Forehead to chin, make sure you get the cheek in the middle. And we flip. Forehead to chin, get in the cheek in the middle. Then we want to make a mitt. So we take that folded part, put it on the other hand. Put your other hand on top like you're clapping. Put your thumb under, and we just tuck. And it gives you another clean area. Maybe just wash straight down the middle. Put that in the dirty clothes. Now we dry. Anytime we wash, we want to dry. So we just pat the patient's face dry gently. And then that's wet, so we want to go ahead and fold that up. We tuck the wet part in. And now we want to turn the towel counterclockwise towards you. Remember, don't shake. Keeping the patient covered. So now we want to go ahead and put the patient's arm on top of the towel that keeps the bed from getting wet. And now we go for soap. So we're going to use, we have 2 washcloths, one to wash and then one to rinse. So we want to lather up away from the bucket. You don't want soap in the bucket because that's also your rinse water. So the towel is folded in the same, folded in fours. So we wash from the shoulder down, so shoulder to the wrist. Then we flip it. Then we go inner arm to the wrist. And we flip. The back side of the arm where the elbow is. And then we flip. The last little flap washes the hands. Just between the fingers really good. Then we make our mitt again. Turn your hand. Remember, like we're clapping, thumb under and tuck. And this cleans the armpit. So we're gonna clean up in there. Okay, dirty laundry. Now we rinse. We do the same exact technique, minus the soap. So now we rinse it all off. So shoulder to wrist, flip it, inner arm to the wrist, flip it, back side of the arm where the elbow is, and we flip. The last flap rinses the hands and the fingers. And then we make our mitt. And we rinse the armpit. Dirty clothes, and now we pat dry with the flap that's laying across the body. We go ahead and pat dry everything, be gentle. Okay, you want to hold your patient's arm up, support the arm while you roll the towel out away from you and away from the patient. Make sure it's in a ball, nothing's hanging. And dirty laundry, cover the patient's arm up. And now we dress the patient before you take your gloves off and before you dump the water. Remember, don't shake. Just put the gown across the blanket. And then we're gonna have the patient put their arm through for you. We can assist you. If this was a real person, they'd be actually able to assist you. We're going to walk around to the other side, other arm in. Okay, and again, the patient can assist you. Okay. So now we get the blanket, the bath blanket, and go ahead and roll that out gently. Just pull it out nice and easy. And we roll that up into a ball. But first, I'm going to take the string and put it to the other side. So lift your head up, Mrs. Johnson. Okay. Remember, keep this in a ball. Fold the dirty folded inside. Okay. You can turn your head for me, please. So you want to go ahead and tie that string up. You always want to tie on the side. You never put the knot on the back of the patient's neck because it'll cause a pressure sore. So always off to the side. Bring the gown down. Sheet down, just below the gown and bring it back up immediately. Cover your patient up. Okay, Ms. Johnson, I'll be right back. I'm gonna go dump my water and get rid of my soap. Okay, walking over to the sink. Put everything back in the designated area. I'm gonna dump the water out into the sink. Then we're gonna rinse the bucket. Rinse it twice. Then get a paper towel and we pat it dry. Inside and outside. Throw that away. Move our gloves the right way. The gloves in the garbage. We stimulate washing hands. And then we take a clean paper towel and we shut the water off. We take the basin back and put it into the designated area. Go ahead and finish up. Okay, Mrs. Johnson, we're all done here. You did great. Appreciate your cooperation. Just going to put your bed back down to the lowest position. Keep you safe. Would you like the head of your bed up or down? Down just a little bit. Okay. And then here is your call light in case you need to get in touch with me. And go ahead and remove your privacy screen. Make sure the sheet is nice and neat on both sides of the bed. Okay. Okay, Mrs. Johnson, we're all done. Is there anything I can do for you before I leave? Okay, have a great day. Wash my hands, document the procedure. The skill is complete.